Welcome back. Now, high blood pressure affects millions of people worldwide, often without any clear symptoms, yet it can lead to life-threatening complications if left untreated. This evening we're joined by Dr. Nelson Makemba to discuss what causes high blood pressure, how to prevent it, and why early detection is key to saving lives. Dr. Makemba, lovely having you here once again.
Good evening to you, Nina, and good evening to our viewers. I'm glad to be here tonight.
Doctor, to start with, let's start by understanding high blood pressure, what exactly it is, and also why it's referred to as the silent killer.
Yeah, in a nutshell, high blood pressure basically refers to an increased blood pressure. Now, you look at your circulatory system as a closed circuit. You got the arteries, and they go into the capillaries and into the vein. Now, if your heart is pumping and is pushing blood into the circulatory system against an increased pressure, meaning that if your readings are anything north of 140/90 millimeters of mercury when you measure, that's probably an increased and it's a higher blood pressure. And the reason why we really refer to higher blood pressure as a silent killer is because majority of the people, for one, are walking around with increased blood pressure and they don't even know it. And even a good number of those that have been handed down their diagnosis that are on treatment, majority of those are not treated, in a manner that, their numbers are in keeping, they are not getting to target. And oftentimes, even when they present with symptoms, sometimes they are non-specific, things that can happen with any other condition. So that's where the problem comes. People walk around with increased blood pressure, they don't know it, and then over a longer period of time, all the complications sets in, and then that's where the problem starts.
What are the main causes or risk factors that leads to high blood pressure, Dr. Makemba?
Individual really can develop blood pressure due to some reasons. Things like ethnicity, for instance, especially as folks of African descent, we are probably at an increased risk, more than our Caucasian counterpart. Family history, if you were born into a family where there's blood pressure issues, there's probably a genetic predisposition there. Obstructive sleep apnea, especially people that snores a lot, might be at an increased risk of developing high blood pressure. Spinal cord injury or, narrowed vessels into your kidney called renal artery stenosis, adrenal gland tumors such as pheochromocytomas. Those are sort of non-modifiable risk factors where you can't do much. And then we talk of now like lifestyle. For instance, if you consume a lot of salt, if you consume less fruits and vegetables, for instance, because with salt you get sodium, and that sodium makes you retain the water. And then it sort of increases your volume that is in your circulatory system. With the fruit and the vegetable, you get the potassium that helps, drop the BP a bit. But if you're not taking more salt and less fruit and vegetables, there are problems and starts a sedentary lifestyle where you don't exercise. If you prep a little bit big on your two, and then, you've got obesity problem. If individuals consume a lot of alcohol, for instance, people who smoke are also an increased risk of developing high blood pressure, And if you are often finding yourself stressed most of the time, stress also can increase high blood pressure. People who work night shifts, for instance, and they don't rest that much, lack of rest, if you don't get enough sleep, that also might increase your risk of developing high blood pressure, but just to mention a few.
What's tricky for me about this is the fact that there's no real telltale or a sign to say that you've got high blood pressure. And general practitioners would normally recommend to go for an annual checkup. But that probably would not be enough. I mean, if I've gone for a checkup in December and I go the entire year with no symptoms, yet I've got high blood pressure, and then, the following December find out that I do, or, worst case scenario, actually something happens and my health is severely affected. So what are the interventions that we can do as individuals to make sure that our health is in a good state?
Yeah, the first thing that we probably recommend is that whenever an individual, particularly adults, when they visit their primary health caregiver, which is probably a general practitioner, the idea is to have the blood pressure checked, irrespective of the reason why you are visiting the doctor.
Even if it's a flu.
Even if it's a flu, yeah.
Yeah.
So let's do blood pressure routinely. Yeah,
Uh-huh.
that then helps us to pick up if there's any issue there. The second thing also, we have these apparatus that are ambulatory now. You can sort of buy one and keep it at home and actually do self-home monitoring. That's also advocated for. If you are able to do those, especially, you know, on a continual, consistent basis, at any given point where the blood pressure shoots up, you might be able to pick it up, and early intervention can be instituted in that way, because even with clinical presentation, really, you know, the things that we see individual presenting with when they got high blood pressure, they are not, the clinical picture is not high blood pressure specific. In other words, you could have a headache because you slept less last night. You can also have a headache because you have high blood pressure, for instance. You might have a blurry vision because you have high blood pressure, but you might have a primary eye problem. So you might have a chest pain, you know, because of something else. You might have a chest pain because of blood pressure. So the kind of clinical picture you see individual presenting with when you got high blood pressure is not necessarily limited and specifically pointing to the presence of high blood pressure. So the key and take-home message really is to consistently monitor your blood pressure on a consistent basis. And at any given point, if it goes up, you'll be able to pick it up on time. Yeah.
Dr. Makemba, I don't know if you've noticed, but it seems that younger and younger people are being affected by high blood pressure. And it's not necessarily, as you mentioned, you know, lifestyle choices can be a contributing factor, but even sometimes healthy young people, you know, are succumbing to, you know, the demise of high blood pressure. Yes.
Yeah, we picking up blood pressure even in the individuals that are in their 20s nowadays. Yeah, so the challenge really, high blood pressure is a pandemic, and it's a global pandemic. It's not only unique to Namibia or Africa. It's and the pattern is the same everywhere, even in the developed countries. Unfortunately, people are walking around not knowing, or they are diagnosed and treated, but they are not getting the numbers to target. So it's basically a universal problem. You know, in the health fraternity, we are always evolving, trying to find a way to sort of communicate effectively to the patients also, so that they have a better understanding of what really blood pressure is. By far, most of the people, even those that are diagnosed, they are walking around with the attitude, well, I went to the doctor, he told me my BP is up and I'm given some tablets. I'm popping that pill in the morning, and they are not even checking to make sure that, you know, am I really now getting my numbers to where it's supposed to be? Because if you're taking medication when you are diagnosed for that matter and you're not getting to target, it just, you know, it's an exercise in futility, because the medication isn't doing you any good if the numbers are not looking good. So the idea is to take medication first and foremost and get the numbers to target.
Right.
And if you're on medication and maybe you're not getting to target and you're consistent in your taking the medication, you have to go back to the doctor. The doctor need to evaluate, is the kind of tablets I'm prescribing good one for you, or maybe we need to readjust some dosages or give you a different molecule altogether. So that is really the kind of message we're trying to get out there. And our diet has gone Eurocentric now. We're consuming a lot of, you know, fast food, you know, minimum recommended salt intake is at least 5 grams or less a day. We're consuming probably quadruple that number. You know, you get that from your biltong, you get it from your chips, you get it from all kind of stuff that you're basically eating.
Yeah.
So there's really a challenge there, and you know, we need to push as much and as hard as we can. And also for our patients that are at least, you know, diagnosed and know that they are hypertensive, we have to, you know, get the message across to say it's not just taking tablets, but it's making sure that those numbers, you know, are at least, you know, 130, 80, you know, even some society like the European Society of Hypertension actually make those numbers strict, 120 to 129 over 80 to 89. Yeah, so we need to actually get those numbers reading, otherwise, you know, we are just, you know, dispensing medication, but we are not actually helping anybody.
Yeah. If high blood pressure is left untreated for too long, Dr. Makemba, what are some of the other effects that it takes on the body?
Yeah, you develop what we call mediated target organ damage. If your blood pressure is not controlled over a longer period of time, Nina, you can get a heart failure, for instance. You can get a heart attack. You know, you can get kidney failure, and now if your kidneys are failing, over and above having high blood pressure, you now need dialysis. All that can actually affect your quality of life. You know, you can get a stroke, for instance. You can also get the vascular dementia, because now your blood pressure has been higher for too long, and then you become forgetful. Men do develop erectile dysfunction, and that also becomes a problem at home because he's no longer able to, sexually satisfy his partner, for instance, and that can make a man depressed as well, and that might affect, the dynamics in the family setting. Yeah, these are some of the things that can actually happen when individuals go for a longer period of time, with a blood pressure that is not controlled. And when these complications kicks in, unfortunately, what it does, it reduces your life expectancy. What I often say to my patient, especially those that are hypertensive, just to help them understand, the seriousness of the condition, is to say the painful thing with high blood pressure is that you might not feel anything when you are young, but then once the organs are damaged, and you're a bit older, you might not be there to raise your grandchildren. Whereas if you are diagnosed very early, you might not be there to see your children graduate. Yeah, so. And we normally say every day you go with a blood pressure that is not controlled, you reduce your life expectancy by 5 years.
Wow.
Yeah, so assuming you're supposed to live up until you're 95, every day you are going with an uncontrolled blood pressure, saying 95 minus 5, today you're at 90, tomorrow you're at 85. So it goes. And the concept behind that is that, when you get to a bit of an older age and the target-mediated organ damage is set in, then that's where you see the problems. We will try to keep you going, but if your kidney gives up on you, your heart gives up on you, worse, you develop a stroke, there's not much that we can do, if the organs are failing you.
Yeah. Let's talk the treatment methods, doctor, because I think one of the reasons a lot of people are also afraid to go on medication is because we have this notion that you have to be on this high blood medication for the rest of your life, and you sort of see it as a nuisance, but there are different options of treatment. Just talk us through some of the most popular ones.
All right. First, let's probably address it, non-pharmacological and pharmacological approach. Non-pharmacological meaning that what can I do outside taking medications? For instance, either to reduce the risk of developing or to delay developing high blood pressure. Exercising regularly, eating a lot of fruits and vegetables, reducing salt intake, quitting smoking altogether for the individual that smoke, reducing alcohol consumption, just resting enough, getting that 6 to 8 hours sleep, managing those stresses if there are any. And then obviously we go to the pharmacological intervention, where if the diagnosis has been established, it is probably advocated for individual to make peace with the diagnosis and take the medication as prescribed by their caring physician. And the world has really evolved. We have even moved into what we call a single pill combination method, where you get 2 tablets but combined in one. So you drink 1 tablet but you're getting the benefit of 2, or you're drinking 1 tablet but you're getting the benefit of 3 tablets.
Right.
So what that aims to do is to reduce the pill burden and then improve adherence or compliance to medication, and then hopefully we get to target. And individuals that have been given the diagnosis of high blood pressure, really, I don't think the idea of you having to take tablets every day should not be so overwhelming, because if you look at the benefit compared to you not taking anything at all, I would rather at any given point advocate for individuals that have been given the diagnosis to say it's better to take something, bring down those numbers, and then preserve the organs. Because once the organs are damaged, the challenges comes in now. Keeping them going, it's a problem. And you need these organs for vitality and life. If your heart gives up on you, there's not much we can do. If your kidney gives up on you, there's not much we can do. We might put you on dialysis, but even that also affects your quality of life. You might have to go into the dialysis center 2 or 3 times a week, and you have to spend at least an hour to 3 on a machine. So your quality of life is gone as well, you understand. So at that time you're supposed to be maybe at a football match watching your son play, or at some classes watching your daughter dance or whatever, but you can't be there for your loved ones. And also all the other challenges that comes if you get a stroke. You are wheelchair bound, people have to push you all around in the house, have to take you to the bathroom. Sometimes you might even have to be fed by somebody else, and now you are entirely dependent on a third party. That can be very depressing in itself.
Well, Dr. Makemba, thank you so much for being here with us this evening. I hope the viewers has learned as much as I have. We appreciate it.
Thank you very much. It's always a pleasure being here, Nina.
That was Dr. Nelson Makemba speaking to us there on the issue of hypertension, also known